Well, Nutrition Therapy Association, how are you guys? Forgive me for taking a little bit longer to get up with all of you. I have a little technology challenge. What I'm doing is a little Facebook Live here from the University of Iowa. I just finished up my research meeting. And so, hey, I'm glad to see that we've got someone on board with me. So we're going to be talking about food. We're going to talk about the radical notion that food is how we get healthy and strong and vital once again. I'm sort of going through my notes in terms of nutrition therapy. I first came across your organization when Joel Hansen reached out to me. Hey, Holly, thank you. So Joel reached out and asked me to come to the annual meeting back in 2014. And so I went out, had a wonderful time. I was very impressed with the caliber of the organization and the caliber of the talks that were given. And then this last spring, I came back and had, the happy privilege of meeting Dr. Natasha Campbell of the GAPS diet. And so that was just a marvelous, marvelous opportunity to get to interact with Natasha, hear her remarkable story. And of course, she had some great insights as well. So again, that was a terrific conference. I appreciate the chance that I was able to talk about my opportunities teaching to a group class, and how, at least for years, I taught people in group classes that did not have money, were living on food stamps, and that I was really working at teaching them how to begin to think about food, how to do things like what's in the food budget. It's everything we put in our mouth: tobacco, alcohol, energy drinks, fast food, snacks, and the groceries. We taught people how to make menus, how to plan for leftovers, how to eliminate food waste, and in so doing, we're often able to help people dramatically improve the quality of their diet and help them save money, which I think is really very important if we're going to help create an epidemic of health. So people told me I should comment on what is it that I'm doing. So last week I was at the Institute for Functional Medicine. There was a course on neuroprotection, which was really quite marvelous. And it's, oh, great. We have some questions coming up. So I don't see the questions. Oh, here we go. So first one from Lindsay. With your rheumatoid arthritis, you've had hair analysis, tried diet protocols, switched my life to... I can't see any more of the question there, Lindsay. So I'll just sort of generalize this on rheumatoid arthritis. And I have to remind anyone who's listening to this that I can't diagnose or treat in a Facebook Live setting. I can sort of provide information and a generalized point of view or perspective. So if people have rheumatoid arthritis, I often find that nightshades are a big problem. Tomatoes, eggplants, white potatoes in particular often can be very inflammatory. So getting those out of the diet can be helpful. I know Steve Gundry has found that lectins in seed spices can be very inflammatory. And so removing all seeds, nuts, can also be quite helpful. Now, here's another question about Guillain-Barré. Yes, that's an autoimmune condition. I certainly would try the Wahls Protocol for Guillain-Barré. Now I would also assume that myasthenia gravis is autoimmune. I think ALS is autoimmune. Schizophrenia is probably autoimmune. And so you can start with level 1, move to level 2 pretty quickly. If you continue to have symptoms, then you might think about reducing the lectins and taking out nightshades very well. Of course, there's a lot to be said about getting a homocysteine level, understanding your vitamin B12, vitamin D levels, folate levels as well. Do you have some more questions here? I'm trying to scroll through. For those of you at Holly, you just shared my video, so thank you very much. I haven't seen any hearts lately, so I'm hoping you guys are enjoying what we're doing here. From Sylvia, in treatment for myasthenia gravis, any modifications to the protocol? Actually, no. It's the protocol I would expect to be very helpful. Certainly, it would be very wise to know the B12, the vitamin D, the homocysteine. Recent MS diagnosis, I'd absolutely start the protocol. Certainly read the book. We talk a lot about getting fasting lipids, A1Cs, B12, folate. Get them on the diet right away. They may benefit from taking salumedrol to quiet the inflammation initially. But ideally, you want to wait on the disease-modifying drugs to see how much benefit you can get with using diet and lifestyle. People often ask me for the particular condition, how many people worldwide are following my protocol? The reality is I don't know. I have thousands and thousands of followers following me and keep getting reports from a wide variety of conditions of things that have been helped. So I don't know how many folks have had scleroderma that have been helped, but certainly I'd be very optimistic for that. People can be skeptical. They may be pre-contemplative. All you can really do is offer the information, create curiosity, attraction, and then they will come at the time that they are ready to come. Stan, at the Hyatt. I'm glad you get the chance to chat with me here. 2 Paleo sisters. Yes, I'm glad to hear that you're following the protocol and it's been helpful for you. Let's see, what other questions? Do we have any more fresh questions? People have asked me what we're doing. So I have the low saturated fat, the Swank diet, and the Wahls diet study that is going on right now. We're recruiting for that. So if you have anyone who would be interested in being in our study, willing to be randomized, they could reach out to us at msdietstudy@healthcare.uiowa.edu. And I would also, for that study, people have to come to Iowa 4 times. We're also partners with a group in Bastyr who is doing a study where we're comparing and following people with their diet, supplement use, and seeing them just with surveys every 6 months for 5 years. So even if you don't want to come to Iowa, please contact us at msdietstudy@healthcare.uiowa, because just doing those surveys every 6 months would be very helpful. We have about 1,000 people in that study, and it would be very helpful. Now, people ask me, would I study scleroderma? I have to remind everyone, I'm happy to conduct any studies, but I can only conduct studies in which we are being paid to do those studies. And so that generally means that we need to have some pilot data. So I've got pilot data in the MS world, and we're doing that. We do have a couple of interesting cases with ALS that have been greatly helped, and I'm writing a protocol to test this protocol and others with ALS. NTA Australia, yes. Australia, I'm hoping that I could get out to Australia sometime in 2018. And I have some folks that are working on trying to make that happen. How do you get pilot data? That means I need to have the money to conduct the pilot study to get it to happen, Misty. The other thing that could be helpful is getting case reports written on folks who've used the diet and scleroderma. We recommend that people donate to my foundation. Okay, I'll try again. Because I'm here at the university, the connection is weak. I'm having to use my phone for the go live, so I hope all of you will hang in there with me. We had some more questions as to what else. I'm good. I have one person watching. I'm hoping we'll get a few more sign up to watch. I had about 40 when we lost connection last time. So at any rate, Holly, great, thank you. Glad we're here, and hopefully we'll get a few more folks on board again. So all of you who are watching, please sign up for my newsletter at terrywahls.com. We'll be having a webinar June 22nd. I'll also review my story. I'm going to be reviewing the research at a high level that's been done in the last couple of years as it relates to diet, lifestyle issues. So I think you'll enjoy that. I'm going to have a Wahls warrior who's had an issue with traumatic brain injury and how the protocol helped him recover. Another person with Lyme's disease, who, by the way, is a nutrition therapy practitioner, who will be talking about how it helped her. I'll talk about the various programs that we have to help people implement the programs. And I'll talk about a Wahls Protocol seminar that I have every August. And this is a 3-day event. We have people who come from all over the world, including some Australian folks. And we have a 4th day now. We have clinicians. I have nutrition professionals get certified. So there will be Wahls Protocol health professionals listed on my website, and then can use my trademark terms. Misty, you've got a large face group on scleroderma and functional medicine, collecting diets used in my group. We could talk about if we can get a case series written up on scleroderma and functional medicine. If anyone's got that, you could reach out to me, and I can sort of help get that written up. So I'd say that's the first step, is to get a case series. And then if one wants to do a forward looking collection of data, we need to get funding to have a clinical coordinator and to get all of that happening. Really it'd be pretty tough to do it for less than about $200,000. Research is unfortunately expensive. It's still very expensive, even at the pilot level. Heal, thank you for sharing the video. And Tony, I look forward to seeing you as well. Thanks for being on board. I'm so proud of you working on your nutrition therapy practitioner status. And all of you who are in the program, you're really doing such lovely, lovely work. You have a rich training, and Thomas Edison talked about the physician of the future would interest his or her patients in the use of diet and lifestyle to improve the health and energy of that individual. And that is the physician of the future. It is all about health behaviors. And the most critical health behavior of all is the food that we eat. Are we creating more health and vitality, or are we not? Okay, I need some more questions, you guys. Come on, get them going. There's really, all of you watching, think about coming out to the event in August. Even if you can't come from Australia, we have a number of folks who get access just so they can get, because we get live recordings of audio of everything, and I do video screen capture recordings of all the talks that I give, and people have people who can't come, if they let us know, we get them access to the seminar. Okay, Holly, what are the top 3 changes to tell a newbie? Get rid of the sugar, get rid of the white flour. So swap out all of the grain-based stuff for vegetables. And I'm very fond of organ meat, so I want them to get a couple servings of liver and onions. Any advice in finding good studies in PubMed? I just go to PubMed. And Misty, I think you were the one interested in scleroderma. So why don't you search out scleroderma and microbiome and see what you get. And you could also look for scleroderma and recovery case reports. They might be interesting to see. Misty, you get those case reports in a case series written up. If you've got them in your group, that could be really quite compelling. You know, and I've had people with psoriatic arthritis, mixed connective tissue disease, rheumatoid arthritis, all do remarkably well with our protocol. So again, I would be very optimistic about diet and lifestyle approaches to scleroderma. Do we have some more questions there? Those of you who are signed up, why don't you let me know where you are from around the world? It'd be sort of fun to see. Because Tony, I know, is out in New York, and I know several of you are going to be over there in Australia. Okay, top 3 lifestyle changes. Okay, so we've already talked about food. Adding a stress-reducing practice, and I think this can be something that you enjoy. Walking, Epsom salts baths, journaling, gardening. I think that could be very helpful. Tending to your sleep, so sleeping well at night. And, you know, a nice thing for stress reduction is taking an Epsom salts bath. That can be really quite lovely. So we have somebody from California. Oh, and Beth Schultz. Hey, you go, girl. Now, what can I tell you guys? In terms of our research, we've had a couple of papers that came out this year. We had a nice paper that talked about the improvements in cognition and mood that were observed in the group of patients with progressive MS. And we'll have another paper coming out on the gait. That'll be coming soon. The MTHFR gene and supplementation. So if you have that gene, you don't know if your enzyme's more efficient or less efficient. So sometimes it's really helpful to know your homocysteine. If your homocysteine is high, taking methylfolate, methyl B12 may be very helpful. Is there, you know, Stan, there's a lot of stuff that I've learned since I wrote the Wahls Protocol. That's part of why I have my seminar, so I can update people on the things that I've learned. So I spend a lot more time on the resilience factors and more on some of the lifestyle factors. Iron toxicity, yes, that can be a problem, Misty, and that might be part of why women having the menstruation and losing some blood every month may have turned out to have been very helpful to us. You guys got any more questions for me? Well, I'll tell all of you guys that I have a sore throat. I've had a cough, a little viral thing. So here's my my personal approach towards viral things. I up my vitamin D. I make sure that I've been flossing my teeth really well because I don't want to have any gingivitis problem. Some oregano oil can be very helpful. And then eating a couple cloves of garlic 2 to 4 times a day. And that can help you more effectively fight off the viruses. And then, of course, throat coat tea. So when I get home, I'll be having a bunch of throat coat tea tonight. Any more questions from all of you? Well, I see that I'm getting sort of weak again. Wait a minute. High-fat diets in the microbiome. So the dairy-based ketogenic diet starves the microbiome. I am not at all a fan of that. But I'm fine with medium-chain triglyceride ketogenic diets because you can have 60 to 80 grams of carbs. The graduates, to continue your education on MS, Diane, come to my seminar. That's be really very helpful. I mean, seriously, all the Nutrition Therapy Association folks, I really would like you guys to come to the seminar. I specifically wrote this so that we could also certify the NTP graduates because you have a nutrition certificate. You need to come. There's 3 days. You see how I teach the public and teach these very complicated science concepts. The 4th day is very clinically oriented. I would go through cases. I review the Bredeson's protocol for Alzheimer's, how that's similar and different to my protocol. And so this would be great for people who would be graduating in June, could come by. And then once you get certified in the Wahls Protocol, you're able to be licensed. And so then we could list you on our website. Yes, dairy, if you're trying to be in ketosis with dairy, you can only have 20 grams of carbs a day. And that really serves the microbiome. It's a problem. It is a huge, huge problem. Okay. Let's see, did I catch all of the questions here? Allison, for sure you should come sometime to the seminar. I think you'd have a great time. Okay. Well, I'm going to show you guys my humble office here, so hang out. Pretty small. Here we are. So, pretty small, ordinary university office. It's not that big a deal. Eternally grateful, 3 years with MS. No hands, no mobility, blind. Now, Diane, I'm sort of and you've been hard at work. You're perfect. You're going to finish the NTA in a couple of weeks. Oh, very good. I'm so glad for you, Diane. Beth, if the dairy's only butter, it's still only 20 grams of carbs. It's the fact that medium-chain triglycerides generate more ketone bodies. That's why you can have up to 60 to 80 grams of carbs. So coconut oil, MCT oil, or you can eat every other day. A lot of folks find that pretty tough, but that's certainly another option as well. And these are some of the things that we cover at the seminar. These more nuanced concepts that I've learned since writing the protocol, and so the really very exciting work that Dale Bredeson has done with Alzheimer's and how he's been able to reverse early and moderate Alzheimer's. Brain octane oil is MCT oil. Now that may be tolerated. You'll find that some folks have more trouble with nausea, vomiting, diarrhea with that. Okay, last call for questions. I'm going to wrap this up because But I want to thank all of you guys. Again, I want to thank the NTA. I think you guys are doing such marvelous work. And you have such an important role to play in creating this epidemic of health that is just so important. Because it will only happen by teaching the public how to eat for health. So that means lots of vegetables, some organ meat, some bone broth, sleeping at night, moving more, getting outside, gardening, taking up some salt baths, writing, having deep connections with people, more social time. Okay. So much ghee, goat cheese. Gotta be a little careful about the cheese, might be a problem. Okay. Beth has done great stuff. Come to the webinar on June 22nd. So if you guys have not signed up for my newsletter, please do so, terrywahls.com. Then you can get an announcement about the webinar. Sign up for that. It'll be marvelous. And you'll get to hear Beth talk a little bit about her stories, because she'll be one of those attendees. Again, to all of you, thank you. And by the way, I am hoping to get to Australia and be doing some events in Australia in 2018. We'll see. Take care, and love to all of you. Bye-bye now.